Picture this, you are walking down the street and suddenly a car backfires. In that instant, your heart races, your palms sweat, and you are overwhelmed with a sense of panic. For most of us, these feelings will subside shortly. However, for some individuals, they may develop this traumatic experience that can leave a lasting impact on their lives. And that is one of the mental health conditions called post-traumatic stress disorder, or commonly known as PTSD. So what is PTSD? PTSD is a mental health condition triggered by experiencing or witnessing a traumatic event. It can affect anyone regardless of age, gender, or background. Common causes include military combat, sexual assault, natural disaster, accidents, or witnessing violence. The symptoms of PTSD can vary from one person to another, but generally they fall into three main categories: intrusive thoughts, avoidance, and negative changes in thinking and mood. Intrusive symptoms are characterized by distressing recurrent memories, nightmares, and flashbacks of traumatic events. These symptoms can significantly impact an individual's daily functioning, emotional well-being, and overall quality of life. Avoidance behaviors may include avoiding thoughts, feelings, and conversation associated with the trauma, as well as avoiding activities, places, or people that trigger distressing memories. While avoidance initially serves as a protective strategy to minimize distress, it can significantly impact an individual's life. On the psychological side, the individual with PTSD may develop constant negative mood and cognition, whereby persistent negative thoughts, emotions, or beliefs related to oneself, others, or the world may be present. This can manifest as feelings of detachment, shame, guilt, or a diminished interest in previously enjoyed activity. The further intensity of negative mood and cognition will affect on current or future events, in which the individual will have constant negative interpretation of the events. Looking at the data and statistics, looking from the age, the study reveals that the median age of individuals diagnosed with PTSD in Malaysia is 27 years old, with a standard deviation of 9.7. This suggests that PTSD can affect individuals across a wide age range. It is important to note that traumatic experiences can occur at any stage of life, and the impact of PTSD on individuals of different age groups may vary. For gender, women are more likely to experience PTSD than men. At some point in their lives, 8% of women and 4% of men will experience PTSD. Based on the National Center for PTSD, women are more likely to experience sexual assault, and this experience carries one of the highest risks for PTSD. Therefore, there seems to be a gender difference in sensitivity to PTSD. By referencing from other data, the actual number for people suffering from PTSD seems to be opposed to the data given, in which gender is more likely to diagnose with PTSD. The data shows from findings indicate that among the individuals diagnosed with PTSD, males constitute a larger proportion compared to female. This gender disparity aligns with existing research, which suggests that males may be more likely to experience traumatic events, such as combat, accidents, or violence. However, it is essential to consider that gender biases and societal factors may influence the reporting and diagnosis of PTSD. In post-traumatic data, it indicates that a significant portion of individuals diagnosed with PTSD in Malaysia are single, followed by those who are married, and a small percentage fall into the others categories. This suggests that both single and married individuals are vulnerable to PTSD. Last but not least, regarding education, the data demonstrates that individuals with secondary education constitute the majority of PTSD cases, followed by those with tertiary education, and a smaller portion falls into the others category. The educational background of individuals affected by PTSD provides insights into potential risk factors and protective factors. As with many mental illnesses, PTSD can be overcome with the proper treatment. One of the treatments that can be done is through therapy. For example, exposure-based cognitive behavioral therapy, CBT, in which patients are exposed to trauma-related stimuli at safe levels. This way, the patient can adapt and slowly build immunity for these types of solutions. Medication-based treatments such as supplements of hydrocortisone can produce positive results. A study conducted by Delahanty, Quillen, and Ostrowski shows that the participants who took hydrocortisone demonstrates lower scores in the clinician-administered PTSD scale, CAPS, compared to those who didn't. Consumption of hydrocortisone directly after trauma is also believed to promote recovery. There are also methods that have been introduced which aim to decrease the likelihood of PTSD developed in an individual, one of which is called psychological debriefing, where the victim of a traumatic incident will receive education regarding PTSD shortly after an incident, and doing a therapy either individually or in a group. Another method is opposed to the previous method. In the military, soldiers are provided with a pre-resilience building training before deployment, as to reduce the influence of combat-related trauma in the field. In conclusion, although preventing PTSD is difficult, efforts to lessen traumatic situations and offer support services can help to minimize the risk of its occurrence. To improve in treating PTSD, diagnosis, treatment, and preventive approaches, research and awareness must continue. If someone is experiencing symptoms of PTSD, it is important to seek professional help for comprehensive assessment and appropriate support before it takes a toll on parts of one's life. That's all. Thank you.